Dear students, welcome back. In the previous session, we have seen the applied anatomy of the lumbar vertebrae. Now we are going to see the another bony part of the abdominal region, that is sacrum. Okay, here is the sacrum. Sacrum is a large triangular bone. You can see here it is in a large triangular bone formed by fusion of 5 sacral vertebrae, 1, 2, 3, 4 and 5. It is formed by the fusion of 5 sacral vertebrae. It lies obliquely at the upper and posterior part of the pelvic cavity between two hip bones. Because of its oblique position, it forms an angle with the rest of the vertebral column known as lumbosacral angle. So because of this obliquity of the sacrum, it is forming the angle with the lumbar region. Okay, it is forming the angle with the lumbar region. This is called as the lumbosacral angle here. Yes, so and because of its shape, that is, it is having triangular in shape. Because of its shape, it is having two ends. One is the apex, and it is having a base. So the superior portion is having the base, and inferior portion it is having the apex. Okay. And it is also having 4 surfaces. One is the anterior surface, that is the view we are having. Another one is the posterior or dorsal surface, and 2 lateral surfaces. So these are all the surfaces. So because of its shape, it is having 2 ends. One is the superior end forming the broad base, and the inferior forming the blunt apex. The inferior forming the blunt apex. Here you'll have the coccyx here. Here this one forms the blunt apex here. And also it is having 4 surfaces. Anterior surface called as pelvic surface, and posterior called as dorsal surface, and 2 lateral surfaces. And also the bone encloses a canal called a sacral canal, which is present on the dorsal aspect. And the sacrum is divided by 2 rows of foramina. Here you can see the foramina here, 2 rows of foramina into median portion, which is traversed by sacral canal, that we can see on the dorsal aspect, and a pair of lateral masses. So these are lateral masses, and which are formed by the fusion of this transverse processes of all the sacral vertebrae, and dorsally with the costal elements ventrally. So here you can see the costal elements, and dorsally we can see the transverse processes fusion somewhat clearly. Okay, now the upper part of the sacrum is massive. So if you can see the sacrum, so the upper part of the sacrum is massive because it supports the body weight and transmits to the hip bone. For that reason, the upper part of the sacrum is massive. The lower part of the bone, here this one, the lower part of the bone is free from weight bearing and tapers rapidly. So it is not that much massive, that much bony part is not present in the lower end. Okay, so this is about the introduction for sacrum, and now we will move on to the parts, that is ends and surfaces in detail. Okay, the first one we are going to see is the apex. The apex is narrow blunt end lying at the lower part, and it is formed by the inferior surface of the body of the fifth sacral vertebra. So the apex is narrow blunt end lying at the lower part and is formed by inferior surface of the body of the fifth sacral vertebra. Okay, and it bears an oval facet. At the apex it is having an oval facet, so which articulates with the coccyx, bone. So this is about the apex. Now we'll move on to the base. The base is formed by the upper surface of the first sacral vertebra, which articulates with the body of fifth lumbar vertebra to form the sacrovertebral angle or lumbosacral angle. Okay, so we will see this base separately. Yes, here comes the base. This is the anterior aspect, that is the pelvic surface, and this one is the posterior surface. So here you can see the sacral canal which is continuous with that of the vertebral canal. Okay, and this is the body here, and these are the transverse processes here. Okay, this is the transverse processes here. This one is the superior articular facets, and you'll have the crest here. So this is the median crest, which are formed by the fusion of all the spines. So which can that thing we can see in the dorsal aspect of the sacrum. So this is the median sacral crest. So just know the parts of it, that is enough. Here this is the body, and the anterior portion of the body is called as sacral promontory, and these are the ala, that is the sacral wing of the sacrum bone. Okay, now so normally this presents features of a typical vertebra, some modifications. So now we will see the body. The body has the transverse measurement more than the antero-posterior measurement. So transverse measurement is more than the antero-posterior measurement. The anterior projecting edge, so this one, the anterior projecting edge of the body is called as sacral promontory. Okay, and the ventral and dorsal parts of first sacral vertebra gives attachments to the lowest fibers of anterior and posterior ligament respectively. So this one is the sacral promontory, and the anterior, this one, the anterior and posterior parts of the first sacral vertebra gives attachment to the lowest fibers of anterior and posterior longitudinal ligaments. On the anterior side, it is giving attachment to the anterior longitudinal, and on the posterior side of the body, so it gives attachment to the posterior fibers of the longitudinal ligament. Now coming to the vertebral foramen. So the vertebral foramen is large and triangular. Next, the pedicles. The pedicles are short and widely separated. Here you can see the pedicles. The pedicles are short and widely separated, which project backwards and laterally. This is about the pedicles. Now coming to the laminae. Laminae is very oblique and project downwards, backwards and medially. So this becomes the laminae here. becomes the laminae. So it is very oblique and project downwards, backwards and medially. The upper border of the laminae gives attachment to the lowest pair of ligamentum flavum. So the upper part of the upper border of the lamina gives attachment to the lower pair of the ligamentum flavum. And the spinous processes are represented by the tubercle, spinous tubercle. And coming to the superior articular processes, which bears a concave facet, articular facet, which face backwards and medially. So this is the superior articular facet, which is convex, which faces backwards and medially. So it is facing backwards and medially. Okay. These superior articular facets articulates with the facets, that is inferior articular facets of fifth lumbar vertebrae. And the transverse process here is modified. And it is represented by a broad sloping mass of bone on the lateral side of the body. So this part, lateral side of the body. Okay, and pedicle, so here pedicle also up to here, pedicle region, and also the superior articular process. So that means the transverse process is modified up to here. Yes, it is modified here. So it is represented by broad sloping mass of bone on the lateral side of the body, pedicle, and the superior articular processes. It is known as ala of sacrum. So this one is called as ala of sacrum. It is formed by fusion of the transverse process and costal element. This feature is not present in any other vertebra. Okay, and it forms the upper surface of the lateral part of the sacrum. So the ala forms the upper surface of lateral part of the sacrum, because this part is sloping laterally. So for that reason, so it forms the upper surface of the lateral part of the sacrum. And this one is further subdivided into, so this transverse process is further subdivided into a smooth medial part and a rough lateral part. So this one is divided into smooth medial part and rough lateral parts. That thing we can see. The smooth medial part is covered by, so here the smooth medial part is covered by psoas major muscle. Under it lies from medial to lateral. So here from medial to lateral, it is having the sympathetic trunk and the lumbosacral nerve trunk and iliolumbar artery, and also the obturator nerve. So the smooth medial part is covered by psoas major muscle. Under it lies from medial to lateral. On the more medial side, it is having the sympathetic trunk and the sympathetic trunk, lumbosacral nerve trunk and iliolumbar artery and the obturator nerve. So these are the structures which is present below the psoas major muscle. And the rough lateral part gives attachment to the lumbosacral and the anterior ligaments of the sacroiliac joint. Its anterolateral part gives origin to the part of the, that is anterolateral part gives origin to the iliacus muscle. So this is about the base of the sacrum. Now we will move on to the surface.